Very much. Now at 4:30, October is Pregnancy and Infant Loss Awareness Month. And this year, model Chrissy Teigen and musician John Legend opened up about the loss of their newborn son. They shared a number of pictures. If you saw them, they were just heartbreaking, like this one right here. And she really shed a light on the emotions of losing a child during pregnancy. Joining us more to talk about this complex and very painful topic is Dr. Elizabeth Deckers, Director of the Maternal Quality and Safety Program at Hartford Healthcare. Dr. Deckers, thank you so much for being with us.
Thank you for having me.
So this is a topic that is often not talked about, possibly because it is so painful. What are the statistics of pregnancy and infant loss?
Well, early pregnancy loss, which is also called a miscarriage, is actually quite common, occurring in about 10 to 15% of pregnancies. And early pregnancy loss is when the pregnancy is lost in the first 13 weeks. If a pregnancy is lost at 20 weeks or greater, we call that a stillbirth, and that is also one of the most common adverse outcomes in pregnancy, occurring in about 1 in 160 pregnancies.
It is so difficult to comprehend the pain and sadness from a loss like this, especially I'm a mom of two. I just can't even imagine. What are some of the emotions and challenges that couples face from a tremendous loss like this?
There are really a wide range of emotions that people experience when they're going through something like this. Some examples would be sadness, loneliness, anger, guilt. What's important to understand is that this full gamut of emotions is very normal, and it really does take time to heal from a pregnancy loss. Absolutely. The good news is there are many resources to help with that.
Well, that is good to know. Also, for people who know someone who are going through this, a lot of times you say, I don't know what to do to help. I don't want to say the wrong thing. I don't know what to do. How can friends and family help and support grieving parents?
Sure. That is such a normal feeling, not to feel like you have the words to express, because really there are no good words at a time like this. At the very least, though, you want to acknowledge that this is going on if this has been shared with you. And sometimes just saying, I don't have the words, but I'm so sorry that you're going through this. Just being with your friend, family member, or colleague who's going through this can sometimes be very helpful as well.
Well, I think, like I said earlier, this is a topic that is not talked about often, and I'm very happy that we were able to shed some light on it today. Dr. Deckers, thank you so much for being with us.
Thank you for inviting me.